Hello, I'm Dr. Rizwana. I'm a general dental surgeon with 10 years of experience and I'm practicing at Jas Dental. No, it doesn't. It is a very wrong perception by the patients that scaling makes the teeth weak and loose or it will remove the layer of the tooth. Now, scaling is a treatment for gingivitis and periodontitis. It is a prophylactic treatment. It removes the hard stains, plaque, calculus which are built up on your tooth, and it doesn't remove the tooth layer. Since your tooth has been held by chunks of plaque and calculus which has happened due to microbial action and improper oral hygiene maintenance. Once it is removed, you may feel the mobility of the teeth, but the gums are going to heal and the teeth will become stronger. Since there is heavy accumulation of calculus buildup, it gives a false sense of stability, which is not the case. Actually, the calculus causes the bone loss and it may lead to eventually tooth loss. So it is very important to do the scaling and maintaining the oral hygiene. Your tooth will be loosened only if you have lost the natural bone and gum support due to prior oral health negligence.